Hello. Before I talk about my main article today, which is on how human beings cope with isolation, I'm going to briefly talk about 3 articles that were published in the Sunday Times on the 5th of April. The first one was a mother who is the sole carer of a 32-year-old young man with schizophrenia, and she posted online that she hadn't received any birthday cards. Later, she received over 80,000 messages online wishing her a happy birthday. The second article is on boredom and how it affects people, and one of the things that the article said was that it increases people's creativity. However, the downside is that people who are prone to getting bored easily can become anxious, depressed, angry, and also addicted to alcohol and gambling. The third article is about goats in Regent's Park Zoo. They were stopping doing their normal activities of play, and they were waiting patiently for visitors to come and see them, who obviously didn't because of the coronavirus restrictions. The zookeepers then did a rota for different colleagues to take turns in visiting the goats and petting them, and then they started their playful activities again. I'm Dr. Beth Colby, a psychiatrist in London from Talk Mental Health. Let's get on to our main article then. This was printed in the 4th to the 10th of April edition of The Economist, and the title, it is entitled COVID-19 and Mental Health Only Connect, and the heading is How Will Humans, by nature social animals, fare when cut off from one another? The article said that COVID-19 is no different to other traumatic world events such as war or natural disasters, and that it affects people's mental health. People are worried about the contagion and their loved ones being sick, and also there's the economic uncertainty and uncertainty about every aspect of life. The protracted isolation in the fifth of the world is also causing anxiety and depression and loneliness. Touch and social networks are essential for humans and non-human primates. It says that female baboons who have more grooming partners or friends exhibit lower levels of cortisol, a stress hormone. At least 2 nurses who worked in intensive care units in Italy looking after people with coronavirus have killed themselves. The finance minister of one of the states of Germany has also killed himself, and it was said that he was deeply worried about the economic impact of the pandemic. Public Health England, along with the Duke and Duchess of Cambridge, have released a set of guidelines on the mental health and well-being aspect of the coronavirus on March the 29th. 62% of Britons said that they were finding it hard to be positive about the future compared to prior to the coronavirus pandemic. As well as the physical health effects, there have been economic and other effects on people, including losing their jobs, their livelihood, their self-image, and the social networks. Single people who might have spent time with others in their spare time are now spending time alone. And if lockdowns go on for months, the older people will suffer particularly. Domestic violence increases with additional strains from living in confined situations. The Lancet, a British medical journal, published an article on the 14th of March. It said that the impact of quarantines could be so severe as to cause people to be diagnosed with post-traumatic stress disorder. And the condition, which includes symptoms such as hypervigilance, flashbacks and nightmares, can last for years. Post-traumatic stress disorder became a formal diagnosis in 1980 after veterans came back from the Vietnam War in 1975. The longer a quarantine goes on, the more likely it is to affect people's health. A study which looked at the impact of SARS found that those who were quarantined for more than 10 days showed more symptoms of post-traumatic stress disorder than those who had been quarantined for less than 10 days. Even under the tightest restrictions, people find ways of coping, and people are discovering that their roads are full of neighbours. Groups are formed in many places to support the vulnerable in our society. Studies have shown that those who feel as though they have supported people in their lives are less likely to react to stressful circumstances than those who do not. Simply knowing you have others on whom you can rely reduce spikes in blood pressure and heart rate. Thank you for listening. Goodbye.